Hello, welcome to AZH Wound Care Center in Milwaukee, Wisconsin. I'm Dr. Jeffrey Niezgoda, the President, Chief Medical Officer, and Medical Director for this clinic. Here at AZH, we strive to provide the best standard of care for patients, and sometimes that involves going outside the box, looking for new technologies, new dressings, new approaches to wound care. I'd like to share one of those with you today. Technology that I'd like to introduce you to is called OxyBand. OxyBand is the first and the only dressing that delivers transdermal oxygen directly to chronic wounds. And we have seen impressive results in the use of OxyBand in accelerating wound healing, especially in patients with compromised healing. Why does OxyBand contribute so greatly to our patients' healing? Well, we know that all wounds, all chronic wounds, are hypoxic. We see transcutaneous oxygen measurements in single digits sometimes. And we know that these wounds require transcutaneous oxygen levels of at least 30 millimeters of mercury of oxygen to stimulate fibroblasts. So the fibroblasts can lay down collagen. 30 millimeters of mercury or more meet the metabolic demands of the wound. For example, less than 30 millimeters of mercury, epithelial cells will not migrate and these wounds just don't close. OxyBand delivers transdermal oxygen to the wound and has been shown to increase tissue oxygen levels greater than 50 millimeters of mercury. And that is the beauty of this technology. So I'd like to introduce you to my patient. Jeffrey is a patient with a venous insufficiency ulcer. As you can see, he's already been on the OxyBand dressing. The reservoir is filled with oxygen and it applies oxygen to the wound base. So we're going to go ahead and change the dressing. I'm going to walk you through the technology and how OxyBand can be applied to your patients, bring benefit to those patients with chronic wounds. So I'm going to take off the old dressing. It's attached to the peri wound using a Tegaderm type of device. As you'll see inside, there's a hydrocolloid layer that provides the moisture absorption. These little holes communicate with the tissue and allow the oxygen from the reservoir to pass through and go to directly the wound. So the first thing we're going to do is we're going to cleanse the wound. You can cleanse the wound in the surface using your standard techniques. We'll go ahead and cleanse not only the wound but the peri wound. And here's a little mechanical debridement to remove some of that fibrinous material across the wound surface. It's important when cleaning a wound to make sure that you don't just focus on the wound base, but rather you want to clean the peri wound as well. You saw the drainage in that prior frame, and that needs to be cleaned off. We really need to clean the peri wound as well. What you'll notice about this wound is already with just very minimal mechanical debridement, we're getting some nice capillary oozing, nice vascularity to this wound. You can see the granulation tissue across the base, and this wound is contracted nicely with through the neoepithelialization process that's been stimulated by the OxyBand. So first we'll dry the tissue. And dry the peri wound. And now we're ready for our OxyBand application. You'll notice that OxyBand is packaged in kind of a bubble type packaging, similar to potato chips. And this is because this packaging is filled with 100% medical grade oxygen. The oxygen in this package diffuses into that reservoir. When that reservoir is placed on the wound, the oxygen diffuses out of that reservoir for a period of 3 to 5 days, providing oxygen stimulation, transdermal delivery of the oxygen to the wound base over that period of time. Very unique and novel concept. Inside the package, you will find a hydrocolloid as well as the OxyBand. So what we're going to do is we're going to put this aside for a second, and we're going to apply the hydrocolloid first. Now, one of the things that you'll notice is it's perforated. This area can be expanded and opened a little larger to accommodate the wound size. So what I'm going to do is I'm just going to open this area, the central area of the dressing, just by removing that center core between the perforations, creating an area that is going to be a little bit more accommodating for our wound. like that. So we take the hydrocolloid dressing, the border off the hydrocolloid dressing. We place that down on the wound base. See how that nicely encompasses the wound. After that hydrocolloid has been secured to the wound and the peri-wound tissue, we then turn our attention to the oxygen reservoir, the actual OxyBand dressing. You see again, it's a bubble, and inside that bubble is 100% oxygen. On the flip side of the dressing, again, we see perforations. These perforations open to a membrane. The membrane is basically a one-way valve from the reservoir to the wound. Oxygen cannot diffuse through the outside of the dressing, therefore it is forced to diffuse through this membrane directly to the wound surface. When you strip off this backing, you activate the dressing, and the oxygen flow begins from that membrane to the wound surface. Again, this is a tegaderm type device. You place this over the hydrocolloid that was placed down before and secure the dressing to the tissues. You see it adheres very nicely. And now that oxygen is flowing in a one-way direction from the reservoir to the wound surface. We're going to walk off this control strip, securing it all the way around the wound. And we now have a dressing that will stay in place for several days, delivering constant, continuous flow of oxygen in a one direction from this reservoir to the wound base, stimulating the wound in the fashion we just illustrated. Jeffrey has been on OxyBand for a few weeks now. His wound is making very, very good progress. Thought you'd like to hear from him some comments as to how this dressing actually works. So, Jeffrey, what do you think about OxyBand?
OxyBand is awesome. I like the fact that you really, it's one of those bandages that you really don't feel you're wearing. The good thing about it is you can tell that the oxygen's there because it has a little pocket of air.
So it feels sort of like a bubble.
Yes,
excellent.
Very much so.
Do you think that bubble sort of protects the wound? And
yeah.
Does it help with the pain? Is this a painless dressing?
Oh, very painless.
Very good. And it's fairly comfortable to wear.
Yeah, oh, definitely. I actually kind of, yeah, I feel it's like a little buddy on my wound.
A little buddy on your wound, that's excellent. You're wearing compression stockings?
Yes, actually, They are over there.
And you have no problem using the dressing under compression?
It actually slips right up. I was really worried about it, and then when I noticed that they were just sliding right up over them, excellent. I was like, awesome.
Have you been able to shower with the dressing?
Yes.
And the shower does not violate the dressing, it stays dry and intact?
It stays intact, the water runs off it, you just lightly dab around the area with the towel and it's ready to go.
So Jeffrey, you've been on a lot of different products for your wounds over the years. How would you compare OxyBand to some of the other technologies?
A fast healer.
It works maybe a little better, or at least as good, maybe a little better.
I'd have to say there was a marked difference from what I was doing.
Excellent. Well, Jeffrey, thank you so much for sharing your story.
Thank you for taking care of me.
I hope you've enjoyed this introduction to a very novel and new technology, one that I think will be a game changer in the management of chronic wounds, the transdermal delivery of oxygen, pure oxygen to chronic hypoxic wounds through a technology that we call OxyBand. Thank you very much.